Kids are dying and are suffering from isolation more than ever before.
Some frightening new information about the number of Connecticut kids dying by suicide and just how young they are when they start thinking about ending their lives. Thanks for joining us tonight for the news at 6. I'm Mike Heideck. Keisha is off tonight. Some mental health advocates joined Senator Richard Blumenthal in Hartford today to announce a bill that aims to improve resources when it comes to suicide prevention. The legislation comes after a new report from the Office of the Child Advocate found that suicide rates among children are increasing, and the ages impacted are getting younger and younger. NBC Connecticut's Amanda Pitts has more.
Of the 10 children that die annually from suicide, the average age is 15.
Mental health advocates say suicide rates among children are going up and trending younger.
Youth ages 10 to 24 saw an increase in suicides by nearly 50% in 2018, and this further increased in 2020 during the pandemic.
Suicide is now the second leading cause of death for 10 to 24-year-olds. Among high schoolers in Connecticut, the numbers are troubling.
14% indicated considering to attempt suicide, 6% attempted.
That's exactly what new legislation aims to do. At the Village for Children and Families in Hartford Monday, Senator Richard Blumenthal announced the Child Suicide Prevention and Lethal Means Safety Act. It would improve education and training, create an online hub of resources, and also encourage enforcement of red flag laws and safe storage of firearms.
If you prevent access to objects of self-harm so that kids have a fighting chance to get some counseling before they act out on suicidal ideation, there's hope.
Dr. Laura Saunders, a child psychologist at the Institute of Living, says there are many factors why, and parents should take note of changes to their child's personality if they're more irritable, withdrawn, and not enjoying things like they used to.
The hard part is parents, I think, realize this and then ask, and children just say, I'm fine, when clearly their words and their behavior are not matching.
Dr. Saunders says the biggest thing parents can do is have a direct and open conversation about suicidal thoughts, no matter how difficult it is.
It's actually a myth that asking those questions directly puts the idea in your child's head. Very often the idea is already there, and the fact that you're willing to ask the question directly is a sign that you're open to talking about it.
In Hartford, Amanda Pitts, NBC Connecticut News.